All right. Hey, folks, this is Bob Mason. I'm the director of the Medical Strategic Network, and sorry for getting started a little bit late. Everything that we had practiced a few weeks ago didn't work when we tried to do it live. But thanks for your patience, and glad that you're here with us. This is the first webinar that Medical Strategic Network's ever done, and this is primarily for people who have attended the Whole Person Care Preceptorship and the Pre-Pro projects over the last couple of years. Preceptorship been over the last 14 years. So glad you're with us, and we hope that as a result this will be an encouraging time for you, and you'll be refreshed, renewed, and maybe hopefully even more so, a little bit more in love with Jesus by the time we finish this. We've got a few guests with us. I'd like to introduce you to first to Greg and Kim Bonnen. Hey folks, Bob Mason. I'm the director of the Medical Strategic Network, and sorry for getting started a little bit late. Everything that we had practiced a few weeks ago didn't work. What is that? But thanks for your patience, and glad that you're here with us. This is the first webinar that Medical Strategic Network's ever done. And so are we okay? So I'm not, so anyway. I still have my old one. So I am lost, okay? A little bit more love with Jesus. But. So what do I need to do?
Bob, I think you may be fine. It may be that there's a delay with the YouTube link, and if you perhaps turn that off, I don't know, but maybe then you wouldn't get the delay coming up on your computer.
Okay. So I got everything else shut down. But anyway, Greg, are you with us? Greg and Kim. Greg is the president of the Medical Strategic Network. So Greg and Kim, welcome.
Thank you, Bob.
Hi.
You guys just came in from New York, is that right?
That's correct.
Yes.
So cool. Well, Greg, Kim, tell us how you first got involved in Medical Strategic Network.
Well, we first met Young and Alice Chen in 1995 when I was doing a fellowship in stereotactic and functional neurosurgery out at Loma Linda. And actually, Kim met Alice on the playground because our kids at that time were very young. Our oldest daughter, Lindsay, was about a year old.
Wow. And so, Kim, what was that like when you tell us about the first time you met Alice?
What I remember is that it was like this picnic of their resident support group, and they only met a couple of times a year, and that was very odd because our resident support group met weekly and multiple days of the week. So anyway, we met on the playground, and she invited me to come to a Bible study at her house, and there was childcare upstairs at her house, and we would be meeting downstairs, and that was really the only way I would have gone to a stranger's house and left my child anywhere was by having her in the same location where I was. So I went to the Bible study, and there were probably, I want to say, like 6 other ladies, and I think it was actually just my child and Alice's child in the childcare, but it was great for me. So yeah, I started doing Bible study on a weekly basis with Alice as the lead of the Bible study, and that was how we met, and that was really a great thing for me because we didn't know anyone out in California.
Okay. Yeah. Well, you know, it's possible. I mean, people who are watching this might not even really know who Young and Alice Chen are. Greg, could you just tell us a little bit, who are the Chens?
Wow, that's a difficult question to answer in a short period of time, but Young, of course, was the founder of the Medical Strategic Network and just was absolutely passionate about not just wanting to share the gospel, but he specifically was called to reach out to all of his colleagues, and that began when he was in medical school back in the Philippines. And so this was just a passion of his that he had throughout his life.
Wow. And as you guys got to know them, what were some of the things that you came to appreciate about Young and Alice?
Well, Kim and Alice actually became close in the years after we met out in Loma Linda, and they corresponded really the old-fashioned way back in the 90s with letters and phone calls.
Long-distance phone calls.
Yeah, before everyone had a cell phone and email.
And cassette tapes. She would send me cassette tapes of sermons and things that she wanted me to listen to, and then she would call me once a week, and we talked for like an hour. Literally.
Wow.
It was long distance, so she was paying big money to call and basically mentor me.
Wow.
And she just had challenged me to know where my faith came from and why I believed what I believed. Was it just because I'd learned it in the church and heard it all those years, or was it because I really knew in my heart these things to be true because I'd read it in God's Word?
Wow.
And she really led me through the beginning of a journey to figure that out, really. I mean, I'd always considered myself, a Christian from childhood on, but it was definitely a new thought to really say, okay, God, make this the main desire of my heart is to know you and to know you more. And so that really was kind of a life changer for me in a lot of ways, to really just take my faith and make it my own.
Wow. Wow.
And it was very impressive to me that someone would take the time and the energy to send me these cassettes or have me read certain things and then call and discuss it with me literally for an hour once a week. And that went on for several years.
Wow. So this was just like a long-distance discipleship relationship.
Yes, it was. It was.
Just the whole thing of spiritual multiplication and living out your faith, and not only keeping it to yourself, but passing it on and instilling it to somebody else.
Definitely.
Wow, wow. Well, that's exciting. Now, when did you two get married? Were you guys in college or med school or after? When was it you got married?
So 1990, and that was the summer between my second and third years of medical school. Kim's an occupational therapist. She had just finished OT school and was about to actually take her national exams and then begin her first job. So really in the middle of our education is when we were married.
So you guys did med school together. You did residency together. You did fellowship, and then you started into your practice, Greg. And Kim, did you work as an OT?
I did. I worked for 4 years doing hand therapy before we started having kids.
Okay.
And when we were going to have kids, we had already pre-decided that I would stay home with them.
Okay.
And mom at that point, because we had both had stay-at-home moms, and that was something we really wanted to have for our kids.
Wow. Well, I mean, so you guys have been through this thing called med school and career, and for a period, sort of balance into professional careers, and then, as you said, children come along. Medical marriage or marriages within the context, and even relationships within the context of healthcare, sometimes can be really challenging and have a unique set of challenges maybe that other relationships and marriages don't face. What are some of the things that you feel like you've learned that have really helped make it through years like that?
For me, really, the resident support group in Galveston was huge for helping me to understand that I couldn't always place all of my hopes and wants on my spouse because they were in a profession that they had very little control over, especially as a resident. And so we'd have plans to go out or do something, and he'd show up 3 hours late. And if I had been banking on that, it was kind of a big mess, because then my expectations were not met and I would be angry, and then it would just kind of be a bad night. So
Oh,
I had friends that taught me to basically kind of be my own person and to say it's awesome when he can be there, but it's okay if he's not, and I can still go out, and another resident wife could be my quote unquote date for the night. We could go together to our dinner club or whatever, so that we would just be able to go and enjoy time outside of the house without
okay.
really having to rely on our spouse for that.
Wow. Well, and Greg, I've gotten to know you over the years, and I can't imagine that you're not being able to be there on time for date night with your wife. Kim was something that was your first choice. What was it like for you on the other side? I mean, your schedule is not, your time is not your own. You don't have a lot of control over your schedule, but what were some things you learned, and how did you cope with that?
So it was definitely challenging, and I was doing a neurosurgical residency, and this was also before the current restrictions on work hours, which actually didn't bother me because I truly loved what I was doing. But one thing Kim hasn't mentioned is we were married, and we also started a family and had our children during residency, and went through a couple of high-risk pregnancies on top of that.
Um,
And for me, it was a combination of, really a shared faith in the strength of our relationship as a married couple. The fact that I did truly feel passionate about what I was doing and did feel very much called to do that. I can tell you, no matter how difficult it was, there was really never a time that I had a second thought or a doubt about whether I was doing the right thing. So I did feel as though I was in the right place at the right time, and then the other was that for me, people would say, "What do you do when you're not working?" And for me, the whole focus really was my family. So if I wasn't at the hospital, I was with Kim, and then later with Kim and the girls, and that was my whole focus outside of residency. And those were really the keys. It was a combination of shared faith, and then our each of us individually in our faith, but also knowing that what we were doing was really what we were called to do, and then being completely dedicated to one another when we weren't having to take care of children or residency.
wow, wow. Well, let me change gears here just a little bit. I know that both of you guys have a lot of things going on. Greg, in addition to your successful neurosurgery practice, you and your brother started a bank, and you serve on the board of directors of that bank. You also are, as we've already heard, a husband, a father, and then in your spare time, apparently, you decided that you wanted to run for office, and you were elected to serve in the Texas State House of Representatives. So with everything else you've got going on in your life, why do you choose to be involved in the Medical Strategic Network?
Well, Kim and I have experienced, firsthand the real impact that this organization can have really through the relationships that are developed, and as you mentioned earlier, the fellowship and the discipleship that occurs. And so what I see that's so exciting, and what I'm excited for also for the future, are really the young people that I see, and the impact that we see, particularly in the preceptorship and now in the pre-professional preceptorship, as well as the the programs and the network that is established with working professionals. And it's just an amazing opportunity to really see people be impacted for the better, and in many cases it changes the trajectory of individuals' lives, and then of course they touch everyone around them.
Wow. Wow, yeah, I remember, of course, we talked about the Chins earlier, and most people know that it was 4 years ago last month that Young went to be with Jesus. Had lung cancer, he'd never smoked a day in his life. He just, one of those guys who got lung cancer. But But anyway, Young used to talk about and used to say that you haven't changed a thing until you change a life. And so that's sort of what I hear you saying. But hey, thank you so much for joining us tonight. I know that it's been a long day for you, flying home from New York where you were visiting with your daughter. So thank you. I appreciate what you do, and we'll look forward to keeping in touch. Right now, what I want to do is, again, sort of shift gears. And, you know, when we started the preceptorship 15 years ago, one of the reasons that we started that was that we realized that we were probably never going to have staff or even attendings who were totally involved and committed with the network on every health science campus in the United States, let alone the world. And so God sort of gave us the idea of starting something in the summer, and we were thinking maybe we can have students come and spend a few weeks with us in Southern California. And by God's grace, we can infect them with the passion and the vision that He has given to us. And then they could go back and they could go back to their campuses and into their practices and clinics and live that out. And not only live that out, but multiply that as well, much in the same way that Kim was talking about Alice pouring into her. And there are a couple of things that we've started doing in the past year that will help facilitate that, particularly among our alumni from the preceptorship and the pre-pro program. One of them is webinars like this, and hopefully in the future a little bit smoother start. But then the other thing that we wanted to do was some of our alumni came up with the idea of why don't we bring alumni together at a reunion and then also begin talking to them about how they can not only serve as faculty at future METS Whole Person Care conferences, but how they could begin to go and start those types of things in their own region as God gave them opportunity and gave them calling to do. And we had our first alumni conference in June, and then we just had another one last weekend in Louisville after the Global Missions Health Conference. And we've got a couple of people with us tonight who came to that first one. One is Valerie Nelson, and the other one is Helena Torres. So Valerie, Helena, welcome. Valerie, why don't you start off first? Why don't you introduce yourself to us and tell us who you are and what you're doing right now.
Hi, I'm Valerie Nelson, and I'm an occupational therapist currently working in Enid, Oklahoma. That's a little northwest of Oklahoma City. And I've been working for 4 years now. Time flies.
Wow. So
before working and moving to Oklahoma, I had the opportunity to be quite involved with METS and CMDA at Creighton University, where I got my doctorate in occupational therapy. So, yep.
Cool. Yeah. Helena, introduce yourself. Tell us a little bit about you.
Okay. My name is Helena Torres. Currently, well, I'm a pharmacist, currently working in Baton Rouge, Louisiana. I work in both inpatient and outpatient settings, and went to the preceptorship in 2009.
Well, great. Helena, what's one of your favorite memories from the preceptorship that summer for you?
Well, besides all the fried food that we ate over the summer, one of my favorite memories is probably doing Soul to Soul. I dreaded it going into it. I remember just being like, I don't want to tell my story. Like, I don't think I've ever even told my story. Who wants to even hear it? But it was really the start of the Lord teaching me how to use the testimony that He's built in my life to impact others, and how to share that story, and how to share that story in a way that glorifies Him. And so
wow.
It's
how about
now
you,
one of my favorite memories, not so much going into it.
Yeah. Valerie, how about you? What's one of your favorite memories?
Well, it's hard to pick just one, but looking back at this summer when I was able to make another trip to Redlands for the alumni training, I quickly realized that the warm welcome from the Mets preceptorship staff and everybody that participates in the preceptorship is something that I will cherish forever. And I think that them just opening their hearts to me, to disciple me, and offer to pray for me about things that were going on in my own life have only encouraged me to be more willing and encouraged to speak about Christ and ask my patients for their permission to pray for them.
Wow. So tell us a little bit about sort of maybe how you're doing that now in Enid, Oklahoma, where you're sitting tonight. How are you how has God given you opportunity to live out your faith as a occupational therapist?
Well, first of all, I guess on a daily basis, just reminding my patients when something good happens, such as I work with a lot of stroke patients and traumatic brain injury patients, reminding them to give the glory to God, first of all. And then, being from Nebraska and having had the opportunity to go to a few Mets conferences, I've been talking to coworkers and physicians that work in this area, telling them about the Medical Strategic Network and just kind of raising awareness that there is a program out there taught by healthcare professionals for healthcare professionals, teaching them how to better integrate their faith into their practice. Because I know a lot of people are just like curious how to do that in an ethical and sensitive manner. And I'm excited to see a conference brought to Oklahoma to teach them just that.
Cool. And how about you, Helena?
Well, again, like I said, I work in two different settings. In the inpatient setting, I actually work in a hospital. I moved to night shift about a year ago, and so I was a little worried in doing that, how God was going to continue to minister to me, to my patients through that. Because when I worked day shift, I had patients that I was able to go in and, as I'm doing their counseling, talk to them about the Lord and share the gospel and pray with them. But the Lord has really used moving me to night shift to help me to minister to my coworkers. Again, they see you day in and day out, and like Valerie says, like many of them don't know what it looks like to live out your faith in your healthcare practice. And so just being able to be that light to them while I'm there. And then this summer, the Lord really led me to pick up a second job in the outpatient setting, just because I really miss patient care. I really miss being able to have an impact on patients. And so I've loved getting to just have more one-on-one contact, being able to pray with patients as we're standing at the counter or while I'm taking their blood pressure, as I'm giving them their flu shot and they're cringing. And so God's just really opened a lot of opportunities for me to be able to pray with them and to share with them just where they are. So,
Helena, what are some of the challenges that you've faced, or a challenge or two that you faced in terms of doing what you just described?
I think one of the biggest challenges for all of us is time, especially as a pharmacist. People want to come in, get their stuff, and leave. I barely have time sometimes to tell them what their medication is for and why they're taking it, let alone to offer to go into a deeper conversation with them. So really learning to mold the conversations to get them to take a deep breath and for me to take a deep breath as well, and to realize that my interaction with them is a spiritual interaction, and that's what I really want it to be, and not just, okay, how fast can I get you out of here, but really, how can I impact your life today? Mm-hmm. So having to purposely step back and take that time has been a challenge, and something that I'm still learning to do sometimes. So. Yeah.
Valerie, how about you? What's a challenge or two that you faced in terms of living out your faith?
A challenge for me is time as well. It's easy for me to get very, very busy, and with a lot of like extracurricular activities and things I'm doing in the community, and sometimes my personal devotion time gets lower on the list. And so one thing I've found that I need to do and do is keep a group of close friends that are my accountability partners, and have them kind of ask me, so how are you doing? And making sure I'm going to Bible study and doing things that aren't just always work related, to encourage my own walk with Christ so that I can encourage others.
Wow. You know, what I hear you talking about is it's sort of something that we would sometimes talk about during the summer, and that is your ministry, best whole person care, is really an overflow of your own walk with God. And so thanks just sort of for reminding us of that, you know, just that need to be tapped in and plugged into that relationship with Christ. You came to the alumni reunion and new faculty training that we did in Southern California in Redlands, right there in the lounge at Brockton back in June, a few days before the preceptorship started, and Helena was there as well. And we talked about, you know, wanting to go back and potentially start, as God so led, conferences in your region, and you've done that. You've sort of taken some steps to see that happen in Tulsa. So tell us a little bit of the story about that.
About that. Well, in the past 4 years that I've been in Oklahoma, it's just kind of always been on my heart to bring a Mets conference here. And God keeps me in Oklahoma for some reason right now. And so I told him, if I'm going to be there, you might as well make me useful. So I have Enid, Oklahoma, where I live. It's a smaller community, but we have 2 hospitals, and I seem to keep meeting more hospital administration staff and people that would be great to get together and have a Mets conference with. So I have been talking with my local church, the missions director, asking him, you know, how to get the word out about such a conference, and then talking to Bob about, hey, well, do you think it would be a good idea to bring a conference to Oklahoma? And then this summer, I was introduced to a lot of preceptorship alumni that are in the Oklahoma and Wichita area. And since I've returned back from California, I've just had a chance to meet with them. And as conversations have multiplied, we have a conference set up to take place in January of this coming year in Tulsa. So God has really answered prayers and just kind of put everything together.
You know, you're right, and it's just sort of been amazing because God's given us a network and given us favor. We're going to be partnering with In His Image residency program in Tulsa, and then also Via Christi down in Wichita is on board, and many of their attendings are excited, and there's some of the residents, and they're talking about coming up and being there. One of the preceptorship alums is down in residency in Oklahoma City, so he's on board, and so it's just really cool the way this network has just sort of come about. So thanks for your work on that. Helena, you've sort of got a similar story. What's a girl in Baton Rouge doing, having an impact back in Indiana? Tell us about that.
So, well, I am definitely an Indiana girl who just happens to be placed in Baton Rouge right now. But since I did the preceptorship in 2009, the Lord's just really given me a heart for the Medical Strategic Network and just for the Mets conferences and for this ministry. I remember one of the girls who was encouraging me to go to the preceptorship said, you know, if you ever want to incorporate your faith with your practice, you have to do this. And that's really been impactful on my life, and just really been excited about being involved. And after this summer and going to the training, was just ready to take those first steps in bringing a conference to the Midwest. There's a lot of alums from my year who are in the Midwest, and then a lot of my friends from years after that and before that, who were in the Midwest. And so I'm like, why don't we have a conference in the Midwest? And so I'm like, okay, let's do this. Like, somebody's got to take those first steps. I'm willing to do that. And so I just started emailing any alumni that I could think of that was in the Midwest, and got a group together. And just like Valerie said, it was amazing to see the doors that the Lord opened and how he was already preparing the way. I went home a couple of weeks after Mets this summer, just was going home to visit, and happened to be able to meet with some of the preceptorship students from that year, and then also some of the presidents of CMDA around the city, and just how they had been praying for this training to come. And so they were so excited that the Lord was already answering their prayers, that they had barely started praying, and just the Lord's faithfulness in that. And I met with one of my friends for lunch and was talking about it, and she's like, oh, I go to that church. Like, I can talk to you, or talk to them about getting you there. And so just all the little doors that the Lord opened, and just his faithfulness in bringing this to Indy. And so I'm really excited to see what he's going to do there.
Yeah, I am too. And I know just last weekend in Louisville, when we did the second alumni and new faculty training conference, there were several who drove over from Indiana to participate, and so that they can be geared up and ready to go in March. And so the Indy conference, I think, is March the 27th and the 28th. Is that right? A Friday, Saturday, Helena?
Yeah.
Okay. So we're going to start on Friday night, and we'll go all day Saturday. We've got some health facilities there in Indy that are on board, where we're going to be doing the practicum. We'll wrap up with a nice dinner on Saturday night. So online registration at the Medical Strategic Network website is up and ready, so go and check it out. And then let me see, Valerie, what's the dates for Tulsa?
January 30th and 31st.
Okay, right. And so we're going to have clear, sunny skies that weekend, right?
And no icy roads, yes.
No icy roads. Okay. So that might sort of lead to the last thing I wanted to ask you guys. What are one or two things that we can be praying for Indianapolis Conference in Tulsa? Helena?
Okay. For the Indianapolis Conference, just for the rest of the details to fall in place, we want everything to be just according to the Lord's will. So where we go, which nursing homes we go to, which hospitals we go to, just that the Lord would continue to open doors for us. And just for all the students and all the health professionals who are going to be there as well, that this would be a weekend that radically changes how they practice medicine and how they impact their patients.
Okay. And then Valerie, what can we be praying for Tulsa?
For both conferences, I would request prayer for marketing of the event, because everybody that is participating in the event is quite busy, but everybody knows people that would probably be interested in going. So I just pray that the word about the conference can reach those that God wants to bring there, and that once He's identified those people, that they can have safe travels, and everything, all the details would work out smoothly for them to attend.
All right. Well, hey, thank you for your work on that, and thank you, Dr. Valerie Nelson and Dr. Helena Torres and Dr. Greg Bonnen and Kim for joining with us. Just a couple of things as a reminder, this webinar will be archived and recorded and posted, I think, immediately as soon as we're done. On YouTube, just go to the Medical Strategic Network channel on YouTube to watch that. I'm sure you're going to want to replay it several times to see us. But then let me see the other thing, a couple of happy birthdays. I'm not sure if I'm going to get in all of them. We've got about 430, 450 preceptorship alums literally scattered around the world, and about 45 pre-pros scattered around the United States. But I know pre-pro student from 2013, Hunter Smith, happy birthday today, and then preceptorship student from 2014, Michael Diate, happy birthday to you too. But Greg and Kim, thank you for joining us, and that's going to conclude the first webinar of the Medical Strategic Network. So good night. We'll do another one sometime in February. We'll let you know. So God bless.